We've all seen the campaigns and we've heard the conversations. Cervical cancer. It's often mentioned, but how much do we really understand? Is it true that it only affects older women? Does it always come with symptoms? And if prevention is possible, why do so many still go undiagnosed until it's too late? Could the HPV vaccine be more powerful than we think? And what's stopping more people from getting screened? Today, we're not here to lecture. We're here to ask the questions that matter and untangle the facts that could save lives. Welcome to Untangle. I am Amadin Ubewe. All right, welcome back. Like I promised last episode, I'm still here, joined by Dr. Fatima Inusa Anga. She's obstetrics and gynecology specialist at the Federal Medical Center. She also has a master's in international public health and is also the founder of Safe Mama. Welcome once again. It's good to have you again.
Thank you.
All right, we were talking about HPV last time. Now we're talking about cervical cancer. Let's start from the basics. What is it?
Okay, let me start by saying cancer in general is an abnormal growth of cells, which can be found anywhere in the body. Could be on the skin, in the brain, in the eye. So any abnormal form of growth of cells is known as cancer. So when this occurs in the cervix, it's called cervical cancer.
So maybe the natural following question is, what is the cervix?
Okay, so the cervix is a part of the womb. Let me use the simple term womb, which translates to the uterus. And the cervix is the lower narrow part of the womb. It's just like the doorway to the womb. Let me put it that way. That's just the explanation.
All right. So let's talk about now symptoms, causes, effects of cervical cancer.
Okay, so let me start with the causes. Okay, so cervical cancer tends to be like the only cancer that has a known cause, which is the human papilloma virus we discussed about. Now, apart from that, there are also certain risk factors that are associated with cervical cancer. So apart from just contracting the virus, there are also some factors that enable the growth of that virus that would now make it to translate into cervical cancer. Now, some of those factors include having multiple sexual partners, having a very low immune system. Low immunity is seen in those people that are malnourished, those who are taking medications such as steroids for a very long period of time, and then even those who are having retroviral disease like HIV. Their immune system is naturally low. So those group of persons, we tend to find cervical cancer amongst them. Then there's also this conception also of males that are not circumcised, transmitting, the virus, and then tend to, predispose women to cervical cancer. And then also sometimes in quotes, those women that take oral contraceptive pills for a very long time tend to also have this disease. Yeah. So that's it about the causes. I don't know if I should move on to the symptoms. Okay. So once a woman contracts this disease, how she can identify the disease, which is the symptoms now, is by seeing some, peculiar changes within her genital tract. Now, one of the most common ones is what we call postcoital bleeding. That's bleeding after sexual intercourse. For some persons may decide to say, is it every woman that bleeds after intercourse that has cervical cancer? That may not be the case. But if that tends to occur frequently, even probably maybe with an intercourse that is maybe not brutal, like gentle and all that, then you have to seek an expert's opinion on that. Then also abnormal vaginal discharge. Some women may tend to say, but women usually have vaginal discharge. It tends to be like a natural form in women. Yes, of course, women have vaginal discharge, but the abnormal one we are talking about is when you now start having probably a vaginal discharge that has a pungent odor or it's causing maybe pain around the genital tract and all that, then we start suspecting cervical cancer. Another one is abnormal vaginal bleeding. The woman tends to bleed, and then even when she's not in her period, normally the normal monthly period, you tend to see her bleed more frequently. Now, if you start seeing all those, you can actually seek experts' opinion, and even lower abdominal pain. Then if, of course, the disease has reached like probably the end stage, you can actually start having the typical symptoms of cancer, which is weight loss, dizziness, easy fatigability, and all that.
All right. I noticed the symptoms you've mentioned now seem to be directed at women, but I understand cervical cancer is for people with a cervix. So does it involve young girls who have no form of sexual activity, or is this something that is only prevalent in older women?
Older women. Well, the prevalence of cervical cancer tends to be more in older women because I think when we're talking about the HPV, I chipped in at some point and said the virus, when it stays within the genital tract or on the cervix for as long as up to 10 years, that is when it can actually lead to the manifestation of that disease. So a young lady or a young woman who starts having sexual intercourse at the age of 18 or 17 may not have the disease immediately. It may manifest in like 7 to 10 years' time.
So are there ways to spot that?
Well, basically the ways to spot it is by doing the HPV screening or the pap smear screening. Now, in the pap smear screening, which is the cervical cancer screening we talked about, in that form, they take the cervical cells and then try to identify if the cells are abnormal, just like how we started in the definition of cancer. Now, if those cells are abnormal, then we tend to check, is this the first stage of the disease, or is it even pre-malignant cells? Pre-malignant cells meaning the abnormality has just begun. Okay, so it has not become full-blown cancer. And then at that point in time, we advise appropriately. Yeah, so that's
there's something I hear a lot when I listen to health professionals and practitioners talk. They say HPV is the main cause of cervical cancer. The fact that the word main is used implies that there's something else.
There's something else. So that's where all those risk factors come in to play. But the main cause, the identified virus that stays there and continues to irritate the cervix for as long as up to 10 years before it manifests as cervical cancer, is HPV. So all those other ones we talk about, like the risk factors I mentioned, low immunity, multiple sexual partners, and all that, are the related factors that healthcare professionals relate to or refer to.
Okay, so is there ever a chance where you can have this and not develop any symptoms?
Like having the
cervical
cancer? Well, it's rare. It's very rare. Once cervical cancer is established, those symptoms are there. They're the ones, in fact, that's what prompts the women to come to the hospital. Yes, because if they don't have the symptoms, they don't really bother. It's just there, and all that. But once those symptoms begin, that's what actually prompts them to come to the hospital.
All right. So what are the preventive measures for cervical cancer? Is it just preventing of HPV?
Well, basically not just prevention of HPV. Prevention of HPV is like probably I would say that's the primary form of prevention. However, the prevention of those other risk factors that I mentioned is also very important. Like, of course, having the MSPs, multiple sexual partners, of course, you could try to either abstain, as we said, or be faithful, or making use of condoms, which of course the condom one we said does not eliminate the virus completely. So that's one way to prevent the virus. Then of course another way is that immediately, that's the secondary prevention now. Immediately you start identifying these symptoms. As early as you identify the symptoms as a female, you come to the healthcare facility and seek help. And of course the tertiary form of prevention, of course that's where the disease has become full-blown and there's little or nothing that the healthcare professional can do except to just treat what he or she sees at that point in time.
What is the general survival rate for when you have full-blown cervical cancer?
General survival rates is actually less than 30%. for 5 years duration, because we explain the survival rate in 5 years term. So for stage 1 disease, usually we say 90 to 99% survival rates. That's when you catch the disease very early. Now, when it gets to stage 4, it's usually less than 30%. Yes. In fact, even less than 5 to some extent.
So at that point, it's almost terminal.
Yes, it's basically because if we're going to talk about the treatment of cervical cancer, you'll see that stage 4 is basically palliative care. That's what we do for stage 4.
All right, let's go on a break now. Okay. And when we return, we'll talk more about the issues of treatment and other things. Okay. Don't go anywhere, we'll be right back.
Culture connects us beyond borders. It's a bridge between traditions, creativity, and the future.
Culture is alive, shaping identities and communities every day.
Art tells stories of resilience and vision.
Artists blend tradition with innovation.
Cultural preservation creates sustainability and empowerment.
Culture evolves and adapts.
Music and dance unites communities through movement.
And right here, in the heart of our cities, artists and creators are keeping these cultures alive.
On Culture Cove, let's explore,
celebrate, and preserve the arts and culture that define us. All right, welcome back. We're still talking about cervical cancer. So, Dr. Fatima, let's talk about the treatment. You've hinted at it already, and you said there are different stages. So, what are the different treatments for the various stages?
Different stages. Okay, so cervical cancer, we have stage 1, stage 2, stage 3, and stage 4 of the disease. Now, the stage 1 tends to be, that's what we call the early stage disease. In that early stage disease, basically what we do is just to do a hysterectomy. It may be quite pathetic, of course, because it's a procedure. The simple term or simple definition of hysterectomy is removal of the womb. So the womb completely goes. And of course, if there's no womb, you know that subsequently fertility is low for her, or even null completely for her. So probably she may have to tend to look for other options of fertility. Now, when you leave stage 1, you get to stage 2 and 3 disease. That's what we call the locally invasive disease. Now, that locally invasive disease is just restricted to around the genital region, but it has gone beyond the cervix. That's to say, it has extended into the upper part of the womb and probably even the structures that are underlying or around the womb. And so in that form, we do a hysterectomy, that's removal of the womb, and then also radiotherapy and chemotherapy. So that's where you hear people talking about going for radio, going for chemo. So
what does that entail? We hear the words a lot, but what do they mean in simple terms?
So for radiotherapy, it's just basically like giving radiation. That's like, I don't know whether I should use the word heat in simple term, radiation to the particular, disease, the site where the disease is. You just send rays to that site, and then it tends to reduce the proliferation of the disease. That's just the simple way I could explain radiation. While for chemotherapy, is administering drugs, basically intravenous medications, into the system that will target the cancer cells and then stop their replication or kill them completely.
So what's the rate of survival for people who undergo these treatments?
Well, the rate of survival for stage 2 to 3 disease, I would say like 70 to 90%, because for stage 1, if you're able to identify, remove the uterus, she may not need any chemotherapy. But except if maybe probably some of the lymph nodes around are affected, then you may tend to give chemotherapy. So for stage 1, we usually say 5-year survival rate of about 90 to 99%. And when you come to stage 2, it's about maybe let's say 60 to 90%, 3, within the range of 60 to 90%. And when you get to stage 4, that's when we'll start talking about less than 50 or less than 30% survival rate. And in stage 4, what we do is that we don't touch the uterus, we don't do any surgery. The only thing is that you counsel the woman effectively, because at that stage, the disease has spread. It has reached the brain, it has probably reached the liver, so it has spread within the blood system. And then at that point, you counsel her and tell her that you cannot, because if you remove the womb at that point, it's like you're spreading the disease more again. So you just leave it, and then you give chemotherapy and radiotherapy. And then also palliative care, you tend to treat symptoms that she presents with that, chemotherapy cannot take care of. For example, if she's anemic, you give blood transfusion. If she has maybe, let's say, cough or something, because sometimes the metastasis can reach the lungs. And then when it gets to the lungs, it tends to start causing cough and all that. So you just tend to treat the symptoms that the cancer comes with. And then you also give chemotherapy and radiotherapy.
So how long typically could someone survive if they've already got into stage 4?
Stage 4. Well, typically, maybe let's say 1 year or less. Yes, 1 year or less. I think the maximum we have had probably is up to 2 years, but 1 year or less is typically the survival rate.
Okay, so you've already sort of answered the question, but to break it down, the conception that if you have cervical cancer, you probably can't have children anymore. I guess that only refers to people who caught it at stage 1?
Yes, actually. So it will not be absolutely people at stage 1 alone. The fact that we tend to leave the womb in stage 4 doesn't mean the woman can actually conceive, because already the cancer has invaded the womb. So there's no way she can conceive again. So practically, I would say once cervical cancer sets in, then conception for the woman is slim, little or none. Yes.
That's dire. I guess when we talk about it, it's good to pivot back to the prevention aspect, so that whoever is hearing this knows that my fate is not sealed.
Actually better.
Yes. When we talked about the screening, I think it was in the previous episode in terms of the timing. So I guess let's hone in on that again. For young ladies listening to this now, how often should they check for this? And we have health experts who talk about some personal, what I call it, examination that people do for breast cancer.
Okay.
Is there a similar one for cervical cancer? Basically, what can women do to protect themselves as much as possible? Because what you just said now, it's not so nice to hear.
Actually, it's quite pathetic. I understand, but take for example the healthcare setting where I am, Federal Medical Center. For every woman that gives birth, when she comes for her checkup, we advise on pap smear. That is also a screening method. Papa smear, that's where you take the cervical cells and then you just check for any pre-malignant disease. Irrespective of her having symptoms, we tend to do it generally for our women, except if you choose on your own not to do, or maybe probably you met someone that forgot to tell you that this is what you're expected to do. But we tend to make it a point of care that every woman that delivers in our hospital, we tend to request for that pap smear screening. Now, that is one way. If you do the pap smear and then you see that the result is normal, the next time she's coming to screen again is going to be in 3 years. And she can be doing it 3 yearly until the end of her life.
What about women who are pregnant?
Well, for women who are pregnant, we don't do it typically for them, except if there's an indication. That is when you start saying maybe she's coming with recurrent bleeding, or already probably maybe the cancer had set in before she got pregnant. Because, it can happen that way. It can actually start and then the woman didn't know. She got pregnant and along the line, she came to us. We now identified that she had cervical cancer. You understand?
Okay, that's fair enough. Speaking about some conceptions, I would just like to check if this is also true. people reference good hygiene and all of that, and then there's this issue with public toilets, and people say, "Oh, I don't want to get something." Is it even something remotely possible? I mean, the HPV that leads to the cervical cancer.
No, looking at the transmission of HPV, you can't particularly point it to the aspect of hygiene. Yes, hygiene is vital, it's very important. But then the issue of HPV is not classically that of hygiene. It's sexually transmitted. So basically, we'll just say it's just, avoiding all those excessive, sexual intercourse and all that. Basically, that's what brings about the prevention.
All right, fair enough. Do you have any final words of advice to, women out there on what to do? And also, if you have any misconceptions as well that you feel you need to debunk on when it comes to cervical cancer.
Okay, basically, the final words I'll have for the women out there is it still boils down to prevention. I think prevention is better than cure. It's a general term, that we grew up to hear about and all that. So if you actually have the means, to get prevention, I think it's actually better. The vaccine is out there, even if it's not probably enough in quantity for now, but it's coming, it's within the country, and then the government is trying to bring up stock the the tertiary facilities and healthcare facilities with this vaccine. So I'm sure that maybe probably in some years to come, we may have it at a very favorable cost, and then also something that is going to be, will I say viral? Let me use the word viral. Everybody will have it. So that's it basically. Linking it with HPV is basically prevention. And then also, of course, if we can, we are going back again to the issue of abstinence or being faithful to one partner or the use of condoms, which of course, as the progress goes, is and the risk actually increases or reduces as the case may be. Then also, if you identify anything you feel is abnormal, always come to the healthcare facility. I know that we may be a bit overwhelmed now. The doctors are, almost everybody is doing jackpot. So doctors are leaving, and all that. And so sometimes actually patients come to the hospital and they feel like they are not taken care of the way they are supposed to be. Sometimes it may just be because of the overwhelming nature of the work. But I think that with patience, and that's why they are called patients, with patience, you should be able to get what you intend to get eventually, and then you should also persist to get what is best for you. That's just what I have.
All right. Also, I think it also answers the question I asked about what they can do. So when you see weird discharge and all of that, seek
just present to the
help.
hospital. Exactly, because sometimes it's not absolutely only cervical cancer that can present with those symptoms. There are some conditions that mimic that symptom. So when you come and then we now rule out what we have to rule out and identify those conditions, then we treat and then we free you and you go.
All right. So I just have one more question. Generally about how there's a word usually associated with cancer when they say my cancer is in remission. When we go through that second and third stage and you're using chemotherapy, radiotherapy, does it permanently end the cancer, or are there usually chances where it can come back?
Well, it depends. It depends, I would say, because to some extent we can actually attain complete cure, particularly with, I've started seeing that complete remission with breast cancer now. It's happening, even with cervical cancer to some extent. And then even some cancers like gestational choriocarcinoma that is also seen in women, to some extent you can achieve permanent cure with it. I've seen a woman that has had that gestational choriocarcinoma, and then at the end of the day, she had cure and she conceived and she gave birth. So we could actually say total you can actually get. But with some diseases, and then depending on the stage that the person presents with, mostly stage 3, stage 4, is usually the remission is the probability of you getting complete cure is very slim. But when you have early stage diseases, stage 1, and probably even some of stage 2, you can actually get that complete cure.
Right. Thank you so much, Dr. Fatima, for joining us on this series and breaking down not just cervical cancer now, but also HPV before. Thank you so much.
Thank you too.
All right, that's how we round off the program for today. I hope you have been enlightened as we've untangled the cervical cancer as an issue of public health concern, particularly for women out there or people with a cervix. So do join us once again on Untangle, where we break down issues and debunk mystifications or demystify issues that have to do with health challenges and also other aspects of life and social living. Thanks so much. I am Amadine Obewe. Bye for now.